Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Today I am going to discuss what you should do if you had previous single miscarriage. I am not talking about repeated miscarriage. If you had previous single miscarriage, what you should do. In that case, it's important to know at what age of pregnancy you had miscarriage. That is whether it was early miscarriage, that is it happened before 3 months, or that is before 12 weeks of pregnancy, or it happens after 3 months, that is after 12 weeks of pregnancy. If it is early miscarriage, that is what happened before 3 months of pregnancy, in that case, no investigation is needed. There is no need to check for antiphospholipid antibody syndrome, genetic test or any other test, and there is no question of testing for TORCH because TORCH test is not required even if you had repeated miscarriage. Therefore, if you had single miscarriage, single early miscarriage, no test is required. If you get pregnant next time, we can start treatment with progesterone, although we don't know whether progesterone actually reduces the risk of miscarriage or not, but it is absolutely safe. Therefore, we can offer progesterone if you are getting pregnant next time in case you experience previous single miscarriage. However, if you had single miscarriage that happened after 3 months, after 12 weeks, we call it late miscarriage. In that case, it's important to find out the cause by doing some tests like antiphospholipid antibody syndrome, checking for thyroid, diabetes, and checking for whether you have any problems inside the uterus by doing ultrasound test. In that case, if the specific cause of miscarriage is found, we can treat the cause, like we can give aspirin and heparin injection for antiphospholipid antibody syndrome. We can remove the septum if you have uterine septum, or we can give you medicine for diabetes and thyroid problems if you are diagnosed with this problem. But what happens if no reason is found? Remember, whether any reason for late miscarriage is found or not, in next pregnancy from 12 weeks, we do a test called TVS, transvaginal sonogram. That is, we check the length of your cervix, that is the mouth of your womb, by TVS, that is by inserting the ultrasound probe in the vagina. Remember, it is absolutely safe and TVS does not cause miscarriage and TVS does not harm the baby. But remember, TVS has to be repeated at the interval of 1 to 2 weeks. If your cervix remains normal by TVS, that is the cervical length is more than 2.5 cm, in that case, we give you vaginal progesterone. In that case, there is no need of giving any stitch, that is circlage in the mouth of the womb. That is no need of giving stitch to the cervix. But if by TVS we find that the cervix is becoming shorter, that is cervical length is 2.5 cm or less, in that case, we put a stitch in the cervix so that the risk of having late miscarriage can be reduced. Therefore, if you had previous single miscarriage, don't lose hope. Talk to your doctor. It's important to know whether you had previous early miscarriage. In that case, no test is required. If you had previous late miscarriage, of course, we need to find out the cause, and depending on the cause, we can give you the treatment. Thank you for watching this video. If you have any query, please don't hesitate to contact us through our Facebook page or YouTube channel, and please like and share our Facebook page and YouTube channel. Thank you very much.